Thank you, Linda. Her prayer made me think of something that I think is pertinent today, which is I think modern medicine is gotten away from God, and it's gotten away from nature, and it's gotten away from what we were biologically designed for. And medicine is co-opting us and basically saying, well, you don't have to take care of your body, you don't have to be healthy, you don't have to eat right, we're just going to fix you, and we're going to fix you with drugs, and we're going to fix you with vaccines. And it's all in the name of progress, and it makes me wonder, are we really progressing or are we regressing away from our original intent? So anyway, that's a little bit of the root of how we all got together and what we're trying to get back to today. Marilyn invited me here to speak today, and I'm not really treating COVID per se. I'm more interested in health and wellness. Our goal is really to empower patients with knowledge. And without knowledge, there's no way for anybody to ever advocate for their own health, for their health or for the health of their loved ones. And so hopefully some of this is just delivering information to you all so that you can advocate for your own health. And you really don't necessarily need a doctor to make you healthy. Doctors in our system today are designed to treat sicknesses, but not actually to make you healthy. And if you want to be healthy, you have to do it yourself. Nobody else can make you healthy. But that's where the information comes in, because a lot of people don't know what that entails. So I've got a lot of resources and some handouts that I've left. I'm not going to be able to go over all of them. It's 4 pages worth. But the idea was to allow you to have podcasts and books and articles and interviews and websites that you can utilize to help support you in your health journey. Interestingly, America makes up 5% of the world's population, and we use 55% of the world's drugs. If that gives you any indication of how sick of a nation we are, and I think that's so important to understand, because the sickness is intentional. They want us to be well because they want us to be sick because when we're sick, they make money off of us. And I think until we know that, there's no way that you can reverse that or prevent that, and it's so important. Our system now is based on science, and it's basically based on profit. And a well patient makes them no money. So you can see why they don't actually want any of us to be well. They need us to have chronic diseases, and they need us to be dependent on their medications. So the question is, how do you get off of that? So let's see what else I want to talk about. So I do believe that disease is really caused by 2 things. One is deficiency in something, whether it's a vitamin, whether it's a nutrient, whether it's a mineral, whether it's an amino acid, or something along those lines. And we've completely negated that in all modern medicine today. We don't really talk about those things, and I think it's really sad. The other cause of disease is toxins. And we're hammered with so many toxins every single day, and part of the process of getting well is learning how to detoxify your body. So I've left some resources about that too. I'm going to tell you my story a little bit of how I ended up where I am today, and I think it's important because I don't want to go around saying that all doctors are bad people. I think that most physicians entered the world of medicine with very good intentions, and they really did want to be able to help and heal people. But unfortunately, the medical establishment is very much about indoctrination and very much about propaganda, and basically just teaching us how to label and diagnose people with diseases and then how to prescribe synthetic pharmaceuticals to fix them. And we don't really concentrate on disease prevention or disease reversal. So I'll tell you a little bit about my story and how I ended up where I am. So I practiced at Brookwood OBGYN for over 20 years. I started in 1999. And I did traditional medicine for a very long time, and I was a very obedient physician, and I did all the things that the establishment told me to do. And I prescribed all of their medicines, and I checked all of their boxes, and I made sure that I was a good provider. And I don't know that I was taught ever really how to think or problem solve on my own. I will say that I did have some intuition, and I was very open-minded because there were physicians in town that did functional medicine, that did more holistic medicine, and I was never one of the doctors that belittled them or made patients feel stupid for seeing them, but I still didn't really understand what it is that they did and how they practiced. I had a patient who was working for a company that basically taught physicians how to do bioidentical hormone replacement therapy for menopause. And for years, she begged me to go to a conference and learn about what she was doing. And I was delivering babies, and I had kids and a family and a busy life. I mean, I was working, 80 hours a week, and I just couldn't find time to go. So when I turned 50, she finally kind of just strong-armed me into doing it. But on the other side of that, I also was becoming menopausal. All my friends and cohort was becoming menopausal. And so I guess it was just a good time for me to go and learn. I went on a Mother's Day weekend. My nurse and I flew out to Dallas. We spent a whole weekend at this course. What was interesting, though, is the first half of the course was all about nutrition. And I was blown away, completely floored, that 8 years of postgraduate education and 20 plus years in practice, and I knew nothing about it. I mean, wow, how humbling and embarrassing, but it was motivating, and I was excited about it. And I did know about bioidentical hormones. I was lucky enough in residency that there was one professor that did teach about bioidentical hormones while I was there, and I was able to learn from him. So I was more open-minded about it, but still excited to learn what they had to offer. And my nurse and I flew home, and I mean, we were thinking of so many people we could help when we got back. All those patients that the other doctors didn't want to see, right? The women that come in with all the complaints. I'm tired. I don't want to have sex. My hair's falling out. I don't have any energy. I can't lose weight, And at the end of the day, it was depressing because as a physician, we were not taught or equipped with any of the skills that we needed to help women. And so all of my colleagues would look at their schedules and say, oh my gosh, look at all these annual exams today. What a terrible day, because that is an awful feeling to not be able to offer somebody any kind of hope or solution to their problems. So anyway, we were super excited about it, and we started delivering some of this care in my practice. So after that, I had a family member that got diagnosed with a really bad autoimmune disease, and it was very, very, very debilitating. And we went the traditional medical route where we saw the primary care physician and then got referred to the specialist, and we saw the rheumatologist, and of course you've got to get your diagnosis so that you can figure out what drugs you're going to be put on. The diagnosis was a little bit elusive, but we finally got one, and then we started all the medicine. And let me just say that the medicine didn't work. I mean, it just didn't work. And it didn't matter what they tried. So knowing what I had learned in my course, I started kind of contemplating the idea of an alternative route to health, and particularly with the dietary change. And I had learned a good bit about the autoimmune diet or an anti-inflammatory diet. And so we started doing that. And 6 weeks later, the disease was 90% better. 6 weeks, literally, is all it took. And that was a huge event for me as a physician to say, you know what, there's got to be another way. And I need to be able to figure out a way to offer this option to patients, and then to share our experience with patients so that they know that there is possible healing. So we go back to the specialist, and he's like, how are y'all feeling? And we're, oh my gosh, we're so much better. And he says, it must be the new medicine I put you on. but he hadn't put us on a new medicine. We were on the same stuff all along. And so that's when it kind of comes up about the diet. And he says to us basically, I can't believe you did the diet. Like, he didn't deny the diet. He didn't say he didn't know about it. He just said, I can't believe you did it, Nobody ever does it. And my thought was, but are you offering it? And yeah, maybe nobody does it, but maybe some of that is because you haven't offered it in a way that has inspired them to try to do it. And I also was lucky when we wanted to try this dietary approach that I had a friend and a patient who was a functional nutritionist. She had worked with a functional medicine doctor in town for over a decade. She had learned a tremendous amount from him. So when I wanted to try this approach, I didn't really know how to teach the diet, but I called my friend and said, would you please help us? And she was able to do that. And it's been 4 years, and we still eat that way today, and we've completely reversed disease, and so thankful for it. And I want to share that information, that inspiration with all of you. And I have put some information on my handouts about some nutritionists. Jennifer is the one I usually refer to, and then I've also invited a nurse practitioner who's going to talk a little bit more about that in a minute, so that y'all have some resources that you can start to utilize so you can implement these changes in your life. The other thing I want to talk about is hormones. I know that's a very controversial topic, and for the last 20 plus years, women have been basically made to be scared of hormones. They've been told that if you take a hormone in menopause or perimenopause, that you're going to get breast cancer. And I think COVID was a big wake-up call for a lot of us, and I think what you realize is that they've been lying to us for 50 years. I mean, or maybe longer, but that's how far I can track it back. And COVID's a perfect example, right? I mean, they come on the TV and tell you, the vaccine is safe and effective. And we all now know that that is not true. Neither one of those statements is true. They've been lying. They knew they were lying, and they're not going to take it back, as much as they're being found out. But the same thing happened with hormones over 20 years ago. So there's a study called the Women's Health Initiative Study. And it took about 24,000 women and did proactive, following them on hormones and the idea was to do it for 10 years. You had 3 groups of women in the study. There were 8,000 women that got estrogen, 8,000 women that got estrogen and progesterone, and 8,000 women that got placebo. And at 5 years, they tabulated all their results and did an assessment and said, okay, what did the study show? And there were actually 8 extra cases of breast cancer in the progesterone group alone. And if you actually look at the placebo group versus the estrogen group, there's no extra cancer when you compare those 2 groups at all. And the 8 extra cancers in the progesterone group out of 24,000 total women was never statistically significant, and you could not say cause and effect based on that. But what happened is the researchers said, oops, we saw, a signal for cancer. Good gracious, they didn't see a signal for COVID vaccines, but they sure as hell saw it for cancer. For breast cancer and hormones. And so they stopped the study. And so they didn't continue it for the 10 years like they were going to. There are lots of flaws in the study besides the data. The average age of the woman starting hormones was 65. They only used synthetic hormones. They didn't use bioidentical hormones. And anyway, so they did what they did during COVID, which is they came on the news and they said hormones cause cancer. With no real explanation, they didn't dig into the details, they didn't dig into the data, they didn't tell you whether it's statistically significant or not. They just said hormones cause cancer, and everybody believed them. We just believed them, except for Suzanne Summers, who didn't believe them, but what did they do to her, right? I mean, they made you think that she was the blonde bimbo in Three's Company and she doesn't know what she's talking about, but believe it or not, she actually did. And too bad we didn't listen to her. But anyway, I think it's important to understand that. Now, there's been a 20-year follow-up on this study that I read 2 years ago. And did they come on the news and tell you this? No. But the estrogen treatment group actually had less cancer than the placebo group 20 years later. So they pick and choose what they want you to know. They pick and choose what data they tell you so that they can make you fearful. And so I've thought a lot about that. Like, what was the goal? Why in the world would they mislead us with this study? And I think it really boils down to selling drugs. So if you can take a woman and make her scared of hormones, then think of all the other drugs that you're going to sell her, right? So maybe she's going to take Prozac because she's depressed. She's going to take Ativan because she's anxious. She's going to take Ambien because she can't sleep. She's going to take Adderall because she can't remember anything. She's going to, take something for her bones. Maybe her cholesterol is going to go up and she's going to have to take a statin. Maybe you'll take something for sex drive. Of course, you'll take something for weight loss. And now there's 7 different drugs that they can patent and profit up and sell you. They couldn't patent bioidentical hormones. And that's another reason that they had to degrade them and demean them to us and make us scared of them. They couldn't get rich off of it. So as a result, again, they tell you all hormones are bad, but they don't tell you that there's a difference between the synthetic hormones that they have on the market versus the bioidentical hormones that you can get, let's say, from a compounding shop. And there's a huge difference because the synthetic hormone, especially the estrogen and progesterone, are the problems. The synthetic estrogen for blood clots and the synthetic progesterone for breast cancer. But if you use bioidentical hormones, those risks really are not, they're not evident. So I think that women are waking up to this. They understand that their lives could be better, their quality of life could be better, their relationships could be better, their health could be better if they took hormones. One of the other things that they didn't tell us is that after they published the Women's Health Initiative study and really just scared the heck out of everybody, we saw tremendous issues with women's health, particularly mental health, bone health, and heart health, and brain health. So there was major detriment that followed this Women's Health Initiative study that nobody cared about and nobody talked about. And I'm not one that's necessarily telling women they have to have hormones, but I think they deserve a choice, and I think they deserve to know the potential benefits of it. And I think everybody in this room is smart enough to make a decision about what's in their best interest for their health if we give them the information. And it's not my decision to make what patients choose to do for their own health, but I'm not going to be one of those that doesn't give them the information and then ultimately let them decide. Answer their questions and deliberate the pros and the cons and then let them decide. But obviously you can tell that I'm a big believer that hormones make a big difference in quality of life. The other thing that I think that medicine doesn't do very well is talk about that quality of life. And, you know, there are plenty of women that will tell me, even if hormones change my risk of breast cancer, I'm going to take it anyway. Because if I don't, I'm going to get divorced. I'm going to get fired. My kids are going to hate me. I'm not going to like myself. And, you know, again, that's their choice to make about what's important to them and what priorities do they have in their life. So obviously I do a ton of bioidentical hormone replacement therapy, and I'm a little bit ridiculed in my circles, just so you know. I mean, even colleagues of mine have called me a voodoo doctor and all kinds of crazy stuff, and it's okay. I'll take it. But it's frowned upon, and it's sad because these are doctors that they still believe in the system. They're still indoctrinated by the system. They can't think outside of that. Now, luckily for me, I went to the bioidentical hormone conference first. That started to wake me up a little bit about alternative therapies and bioidentical hormones and more holistic medicine. You know, we had the issue with autoimmune disease and the ability to reverse that disease, and then COVID comes. Woof. I will say that even as I was beginning to wake up a little bit to the flaws of the medical institution, that this big pharmaceutical industrial complex that we find ourselves involved with, I still didn't quite see COVID for what it was. Some of that is because I was still working my tail off, still delivering babies, and you know, here comes COVID, and they're shutting my practice down, and they're telling us we can't see patients, and I've like got hundreds of pregnant women that we've got to somehow figure out how to take care of. But my husband noted, he knew right off the bat. I mean, literally day one, they said 2 weeks to stop the spread, and he said BS. This is not going to stop after 2 weeks. You know, he knew masks were ridiculous. Just intuitively, he knew something that I didn't know. And it took me probably another 6 months or so to kind of wake up to what was happening. And then you hit a crossroads of like, okay, now what are you going to do with your practice? And are you going to stay establishment? Are you going to stay at this hospital where they're making everybody wear masks? Am I going to participate when they tell husbands that they can't be in the delivery room when their wives are having their babies? Are we going to, you know, quarantine newborns from their mothers because mom tested positive for COVID 3 weeks ago, but she doesn't have it anymore, but they're still going to whisk the baby away for 10 days and not let the baby be around the mama? And, you know, I started having to make some decisions about what do I want for my life and for my practice. So I had a patient that I had delivered 2 of her babies, and I told her in private that I didn't think that she should get her girls vaccinated. And she says, oh my gosh, I can't believe you just told me that. And I was like, well, that's my personal opinion. I'm not sharing that socially, but just in the privacy of my own office. And she says, oh my gosh, you need to meet Jordan Vaughn. And I said, okay. You know, and she said, he's a warrior and you need to meet him. I think y'all would get along. And so that is kind of how it ended up at MedHelp. So there was a group of doctors in town called Concerned Doctors over COVID, and we had several meetings, and In the meantime, I had decided to quit delivering babies and didn't really need to be at the hospital anymore. So I asked Dr. Vaughn if I could join his group. I see Dr. Shepard is here. He also did the same thing, as we weren't necessarily wanted where we were. And Jordan gave us a home at MedHelp to practice the way we felt ethically we were meant to do. And so that's part of the reason that so many of us are associated with MedHelp here today, speaking to you today. So that is really kind of what I was going to say about hormones. The next focus I want to talk about is nutrition. And I think that that is so important, and we don't pay enough attention to it. Let's see. I think food really is supposed to be medicine, and it is supposed to heal and nourish our bodies. And instead, we eat food for energy. That's kind of the way we think about it. We don't think about it giving us all of the building blocks that our body needs to function the way it's supposed to. And the true definition of food is a substance that helps us to sustained growth and that you can use to burn energy. And ironically, about 75% of the food that we have in America isn't really food by this definition. And it's basically consumable poison is what it is. And that's what the majority of people eat. Hence, the 55% of drug use in America versus the rest of the world. And my thought on that is whole foods. We've got to get back to the foods God gave us, not to the foods that man made or really that the devil made. It's tempting and it's easy and it's convenient, but it's not what we were biologically designed for. And I think our bodies look at what we call food and they say, what is this? This is a toxin. This is not food. How in the world are we going to get rid of this toxin? And so I think part of healing has got to be based in changes in lifestyle and changes in nutrition. And I mean, I just can't emphasize that enough to my patients, but so many people just can't wrap their arms around it. They can't figure out how to get out of the rut of this crazy, busy life that we live, and they're just too prone to do something that's quick and convenient and easy as opposed to actually invest in our food. So I think Jennifer's going to talk a little bit more about this here in a minute, but I think that's like so crazy important. Let me see what else I want to talk about. The institution of medicine has been very disappointing to me, unfortunately. And like I said, we've been lied to for a very, very, very long time. I'll never be able to go over all of them, but just some examples. The Women's Health Initiative study that I just talked about. And it really is a lie because they didn't report the data. They reported their biases of the data and really what they wanted you to know out of that study. If they were going to tell the truth, they would have had people debate it and talk about the actual numbers and talk about statistical significance. But that wasn't the point. It's just about controlling you with fear. The more scared we are, the more likely we'll do what they want us to do and not think for ourselves, right? And you just shut down and then you just do what you're told. Cholesterol is a big scam and a big lie. I mean, they've made us think that if you have bad cholesterol that you're definitely going to die of heart disease, and I don't know that that's necessarily true. Cholesterol all by itself is naturally made in the body. It has a purpose, especially for our neurological function, and we've turned around and told everybody that cholesterol is what causes heart disease. And I don't think that's true. What causes heart disease is inflammation in your body. The inflammation comes from all the toxins that we're exposed to. You get inflammation in your blood vessels, and then the poor little innocent cholesterol is floating by, and then it sticks to it. But it wasn't the cholesterol that started the problem. It was the inflammation that started the problem. And so their answer is always a drug, right? Just take this drug and you won't get heart disease. Well, funny, if you actually look at the studies about cholesterol, that's not what the studies showed. The studies actually only showed a 1% decrease in heart disease in people that took a statin. So the statin drugs lowered the cholesterol number in your blood, but it didn't actually result to significant reduction in heart disease risk. And yet, how many people are on this drug right now? How many doctors believe that you have to be on a statin? And they're terrible drugs. They have terrible totally terrible. There are some indications and some places for it, but just for routine preventative health wellness, I don't think that's got a great place. Why wouldn't we treat the root cause of the problem, which is get rid of the inflammation? Why wouldn't we talk to people about diet and nutrition and exercise and stress management and good sleep and all of the things that's actually going to restore their body to health, as opposed to just put them on a drug that has terrible side effects? But why did they do that? So they could make a ton of money. I mean, ultimately, that's what it's all about. In America, we don't do root cause. We treat symptoms. We don't fix people. And I think that's a mistake. Obviously, we know the lie about COVID. We'll touch on that more today. But I think everybody knows that. But even in my own family situation with an autoimmune disease, no doctor actually understands that you can reverse that. You know, it's basically, and they told us, chronic illness, sick for the rest of your life, on medicines for the rest of your life. Like, sorry, that's your lot in life, you're just gonna have to be sick. Well, guess what? It's been 4 years and we've reversed the disease and everybody's healthy. And unfortunately, we did not go back to that doctor. I wish we had, just to be able to show, look what happened, right? You said this disease wouldn't go away, and it did. But we didn't go back because we would have had to pay copay to prove that what we did was right. So I don't know, maybe that's short-sighted on my part. But autoimmune disease, vaccines, is that a lie? Is that a lie? I'm starting to believe that maybe it is, right? Here we are inundated with this idea that we're gonna take, 100 vaccines? A newborn baby today is gonna take 100 vaccines in its lifetime, and that there's no adverse event from that, which I think we now know there is. But if you go back to nature, why do we need a vaccine if God gave us an immune system? Right? If we were equipped with everything we needed in nature to live a healthy life, but yet we've turned our back on our nature and we've turned our back on the gifts that God has given us, and instead we're relying on science to fix us. And I also think that's a major mistake. So, if you have a good immune system, that's what's going to fight the infection for you. I mean, even during COVID, we knew that kids didn't get super sick from it because they had good immune systems and they were able to fight it off, but yet they're still pushing vaccines on them. Think about the hepatitis B vaccine. A newborn baby enters the world, day 1 or 2 of life, they get a hepatitis B shot. Why are we giving a newborn who's not gonna have sex, is not gonna do IV drugs, a vaccine for a sexually transmitted disease? Like, it's bizarre, but yet we all fell for it. I did too. I mean, I was an obstetrician, and granted, I didn't take care of babies, but that was routine in our nursery. A vitamin K shot and a hepatitis B, like boom, boom, welcome to the world, kid. Let's shoot you up with a bunch of chemicals. Another, I don't know if I'd call it a lie, but maybe a misconception, is cancer and cancer treatments. Their idea is let's, just treat with chemo and radiation and not consider alternative options. But there's so many things that we're finding out now, even ivermectin and, and just nutrition alone to heal and treat cancers. So I think people are waking up to what modern medicine is about. They're looking for other alternatives, and that's why we're here, is to share the knowledge that we've gained over the last 4 or 5 years with you. And I wish there was other places to get it. I will say that thank goodness for social media, thank goodness for internet. It is giving y'all options of places to find good information. The hard part is, who do you trust, And that's one of the reasons that I brought some of my resources and some of the things that I trust, just so that if you're curious, you can look into some of those. And I also want people to understand, and I run into this in my practice all the time, that there are doctors who still believe in establishment medicine, and then there are those of us that don't. And we're the minority, for sure. And so I will see a patient and treat their hormones or treat their thyroid or do whatever it is I'm gonna do. Now, I try my best to inform my patient, why am I doing what I'm doing? Why am I taking the approach that I am? So that they can navigate their primary trying to undo what I've done. And the patient gets stuck in the middle, and I'm sure a lot of y'all feel this way, where you might hear from somebody like us about, ooh, don't take another COVID shot, whatever you do. And then you might go to your primary care doctor who's saying you have to take your COVID shot or else. and how do you navigate that, and who do you trust? I don't necessarily know the answer to that, but again, we're trying to provide resources for you so that you can make up your own decision. But interestingly enough, there are probably a lot of patients that know more than the doctors do. And they don't know it because they haven't thought about it, right? They're too busy doing what they're doing to even begin to branch out and look into any other way of trying to treat their patient population. But I have a lot of patients that get kind of frustrated with this. I mean, and every day my nurse and I battle this idea that like I've given them something, now their primary's taken them off of it and told them whatever they do, don't do this ever again. And then I see them back and then I've got to re-educate them again and then start their treatment again. And it's this ping pong action. And I hate it that patients are stuck in the middle. I don't really know how to fix it. And I don't think there's enough of us out there, but that's another reason that we wanted to come and just introduce ourselves and, give some resources to you to help you kind of figure out how you can be your own healthcare advocate and you can control your own health journey. I will say this, it is not easy to be healthy, and especially if you're sick, it really can be a full-time job. I mean, in order to change your lifestyle, to completely change your diet, to completely change your exercise habits, to figure out how you're going to get good sleep, to figure out how you're not going to be so stressed out all the time, I mean, you really have to dedicate to it. And I think that's one reason why patients have just opted for the pill, because it's easier. They don't actually have to do anything or change anything or, but that's really not ultimately going to make them healthy. We're just band-aiding their symptoms. We're not actually fixing the root cause of their problem. So anyway, that's all I had for today. I have invited a friend and a colleague of mine, Jennifer, to talk a little bit about what she's doing. I'm mostly, obviously focusing on women's health. And then we're going to have a lot of discussion about COVID, but Jennifer is a nurse practitioner who has had her own health journey with her family and her children and really wants to focus on children, pediatrics, adolescents, and I think it's so huge. There are not a lot of pediatricians in town that I know of that are embracing holistic health. Or even willing to consider, a delayed vaccine schedule or whatever it is. So poor little Jennifer's kind of on a little island on her own. But I think she's got a lot to offer to families in trying to help with chronic illnesses. And unfortunately, y'all, there's so much chronic disease in our kids. And it wasn't this way 20 years ago. I mean, all the asthma, all the autoimmune diseases, the obesity even, the prediabetes, the polycystic ovary syndrome, the hormonal issues. It's really a travesty, and we've got to fix it. And unfortunately, the kids can't fix themselves, so the parents are going to have to be the ones to do it, and we're going to have to educate ourselves so that we can hopefully help make our families healthier.